Time now for our weekly check-in with infectious diseases specialist, Dr. Isaac Bogoch, who joins us this morning as his two daughters, of course, who are going off to their first day of school. So, Dr. Bogoch, appreciate you taking your time out of the morning to talk to us this morning. I've got to talk about this. I'm going to start with that Donald Trump Truth Social posting yesterday about COVID vaccine effectiveness. He went on saying it's very important that drug companies justify the success of their various COVID drugs. Many people think they are a miracle that saved millions of lives. Others disagree with CDC being ripped apart over this question. I want the answer. I want it now. I've been shown information from Pfizer and others. It's extraordinary, but they seem to never show these results to the public. I'm not going to continue to read the whole thing, Dr. Bogoch. I'm sure you're familiar with that posting there and just sort of questioning whether or not these are effective or not. You're the expert in the field. You've seen the results. You've studied this. What are you seeing? Is there anything being held back? Anything we're not learning about whether these vaccines worked or not?
So initially, when these vaccines rolled out, they did a remarkable job at a few things. Number one, in the early phases, they did stop infection and transmission rather well. They also blocked morbidity and mortality. They did a remarkable job at all three. Now, obviously, with time, we know the virus changed. And, after a year or so, the vaccines did less well in blocking infection and onward transmission. But to this day, they still do a very, very good job in reducing the risk of severe illness like hospitalization and death. And they do a very good job of that, especially in those who are at greatest risk of hospitalization and death, namely older individuals or individuals with underlying medical conditions that put them at severe risk. How do we know this? We know this not just from data that you allude to from pharmaceutical companies. We know this from data that's collected from most countries that have rolled out the vaccine. Publicly available data generated here in Canada, elsewhere around the world, showing how these vaccines did a remarkable job in saving lives. And they continue to do so. But again, I think we just have to be clear of what they did and what they do now. Now the heavy lifting is really reducing the risk of severe infection like hospitalization and death in those at greatest risk. That's what they do now. Earlier, they blocked transmission. They don't do that so well anymore. They do to a little bit of an extent, but not as great an extent as they once did. Okay,
Dr. Bogoch, appreciate that. Thanks for the restart, too. We had a bit of a hiccup, but it sounds great now. I want to talk about this as well. The province expanding its RSV program this fall. Is this proactive? Are they concerned about the RSV season that's coming?
Yeah, I mean, this vaccine was approved a couple of years ago, and all we're seeing is an expansion of who is eligible for this vaccine. It's been out. There's good data generated from many parts of the world demonstrating that those at greater risk for severe RSV disease, again, older Canadians, have some protection from this vaccine. And the vaccine seems to last at minimum of 2 years, maybe even longer. So pretty reasonable results that show significant benefit from a winter respiratory virus that we know can pack as much of a punch as the flu. We didn't talk about it as much several years ago, but it's important to talk about because it's here and it definitely impacts older Canadians and younger Canadians alike. But this vaccine that we're talking about is really for those over 75. I think it's going to do a lot of good in Ontario and help keep people out of hospital.
Well, that is good to hear. I suppose that is the goal indeed. Dr. Bogoch, always appreciate the time. Good luck with the back to school, back to work routine as it is. We'll talk again soon. Thanks so much.